Alright, in this scenario we're gonna discuss about this 82-year-old woman who present with fatigue, abdominal discomfort, leg swelling and pulsations in her neck. 6 weeks ago, she had pacemaker placed for sick sinus syndrome. Her earlier lightheadedness has resolved, but now on examination, patient has bilateral leg edema and a tender pulsatile liver. Lungs are clear and pacemaker site is normal. So what is most likely diagnosed? Aortic valve regurgitation, constrictive pericarditis, infective endocarditis, pulmonary wall regurgitation and tricuspid valve regurgitation, and the answer is tricuspid valve regurgitation. Okay, let's discuss about this. So this is a classic case of pacemaker induced tricuspid regurgitation. Why this happens? Because this is a complication of pacemaker lead which passes through the tricuspid valve and it interferes in its closure. If we discuss about its pathophysiology, whenever pacemaker lead cross the tricuspid valve, it lead to impinge on its leaflet. It can perforate the valve and it also disrupt its closure. Now, since the pacemaker lead prevent closure during systole, this lead to regurgitant flow of blood from right ventricle to right atrium, and this increase venous pressure. And this venous pressure, the symptoms of venous pressure comes as abdominal discomfort, leg swellings, and patient also has fatigue. Now these are the symptoms of venous congestion which happens because of increase in pressure of right ventricle and then right atrium, as blood comes in right atrium from venous return. Okay, the recent pulmonary implantation just suggests that the symptoms of patient might be because of some mechanical cause, and patient also has pulsatile neck swelling and pulsatile liver. This happens because backflow of blood in venous system during systole. And yes, more importantly, the patient has clear lungs, and this ruled out any left-sided heart failure, stating that the problem is right side, and the normal pacemaker side also rule out endocarditis. If we gonna discuss about why not this, here are the other option: aortic regurgitation. Now the aortic regurgitation cause left sided heart failure, and the left sided heart failure present as pulmonary congestions, not pulsatile liver. Okay, and next is constrictive pericarditis. Now the constrictive pericarditis may mimic tricuspid regurgitation, but since this developed gradually, not just after pacemaker placement, as this happens in just a week. Infective endocarditis present with fever and a new murmur and systemic infection signs which are not present in this case. And the next is pulmonary regurgitation. Pulmonary regurgitation is very rare in this case, as this mostly follow the pulmonary hypertension, not the pacemaker placement. See you in next case.